Welcome to the Camp Takodah COVID Safety Webinar, and thank you for joining us. My name is Ryan Reed, and I'm the Camp Director at Takodah. I'm joined tonight by our Executive Director, Artie Lang, our Assistant Camp Director, Carly Fisher, and several members of our Board of Directors. And we're all here because we're working at every level of our organization to ensure a safe and healthy summer camp experience that maintains the traditions and the program quality that you've come to expect from Takodah. Thanks so much for your patience as we've been waiting the updated overnight camp guidelines. The guidelines have changed dramatically several times. In fact, since the finalized guidelines came out a couple of weeks ago, there have already been 3 updates to them. We wanted to wait until we could give you the most updated answers, and we feel like we can do so now. It is possible that the guidelines might change a little bit closer to summer, and if that happens, we'll pass along those updates to you right away. We're also still working through some of the details of the guidelines, and it's possible that we might not be able to answer all of your questions now. And if that's the case, we'll make final decisions and be able to get back with you right away. I want to thank everybody who submitted questions. We're going to do our best to answer those tonight. And if we missed something, or if you have a question specific to your camper, then we invite you to contact us. And you can find our email addresses and our phone numbers on our website at camptakodah.org. We canceled summer camp last year because we didn't think we could run our program in a socially responsible way. With these updated guidelines in place, we believe that we can run a safe and quality program this year. In fact, a recent study from Tufts University just came out that makes us even more confident about camp. Last summer, while we canceled, there were still about 500 camps that continued to operate, and those camps altogether served about 90,000 campers and staff. Among those 90,000 campers and staff, there were only 102 positive cases of COVID infections, and that represents less than 1% of all of the campers and staff served. The study found that adopting strategies that halt the spread of the virus include quarantining, contact tracing, cohorting, and sanitization practices. Those are all the same strategies that we're going to be adopting for this year, and which I'll tell you about during this webinar. All of that being said, we want to acknowledge that while we're taking reasonable precautions to keep everyone safe and healthy, it's impossible for us to eliminate all of the risks associated with COVID at camp. And that means a few things. Summer camp might not be the best choice for some families this summer. We want to be completely transparent about our policies and procedures so that you can make an informed decision about your camp participation. We're also asking campers with health conditions that put them into a vulnerable or high-risk category to consult their primary care physicians on whether summer camp is reasonably safe for them. And the CDC in New Hampshire has identified some of those conditions that you'll want to look into if you have these diagnoses. So lung disease, moderate to severe asthma, immunocompromised, severe obesity, diabetes, kidney disease or dialysis, and liver disease. So if your camper has one of these diagnoses or another diagnosis that puts them in a vulnerable or high-risk category, please do check in with your primary care physician at this time to make sure that camp is safe for them. The last thing before we jump into the guidelines is that we want to acknowledge that we're all in this together, all of our staff, all of our campers, and all of our families. These guidelines only work if we all follow them. We're committed to following them at camp, and we're imploring you to follow all of the pre-camp guidelines at home so that we can create the safest possible camp bubble. So I want to tell you a little bit about how we came up with all of these guidelines. We have assembled a top-notch medical advisory team that includes a chief medical officer of a hospital, an infectious disease doctor, an infectious disease nurse, a pharmacist, as well as our entire summer camp professional team and a COVID safety officer who we've hired especially for this summer. And within that group, we've taken the guidelines from the Centers for Disease Control, the New Hampshire Department of Health and Human Services, the American Camp Association, and several other organizations that serve camps. And we've assembled best practices to inform our guidelines so that we can create the safest possible bubble at camp. We're also putting together a COVID-19 specific communicable disease plan, which we'll post to our parent resources website when finalized. And that will reflect all the things that I'm going to talk about tonight. So these guidelines are really based around us creating a camp bubble. Takodah will be, in essence, its own family for the summer. And the guidelines are based on creating a safe and healthy camp bubble. So we're going to make sure we manage all of the health and safety guidelines at camp. And the other really important thing for us to do is manage migration in and out of camp. For a little bit more context, at this point, we anticipate that all of our summer camp staff will be vaccinated. And at the same time, we anticipate that very few, if any, of our campers are going to be vaccinated. So that will inform all of our decisions. First, shifting our attention to our summer camp staff. Again, we anticipate that all of our summer camp staff will be fully vaccinated by the time summer camp starts. All of our vaccinated staff are exempt from the PCR screening test 7 days before camp, and they're also exempt from a home quarantine before camp. That being said, all of our staff will quarantine at Takodah for at least 10 days before summer camp starts. In addition, all of our staff will have PCR screening tests on day 1 and day 5 of staff orientation. So that means by the time staff see your campers, they will have quarantined for 10 days and had 2 negative PCR tests, and they'll also be vaccinated. In addition, staff will be required to follow all CDC and New Hampshire guidelines during their scheduled time off. Now shifting to camper pre-arrival. There are some things that the guidelines require you to do at home before your camper arrives at camp. And again, the purpose of that is to make sure that migration into our bubble is as safe as possible. So the first thing we're going to do is we're going to provide educational materials for you to review with your campers before camp. And those guidelines will cover things like face masking, social distancing, and proper personal hygiene. And we're going to ask you to review those with your campers and reinforce the importance of those guidelines with them before they even arrive at camp. In terms of home quarantine before camp, the guidelines have changed a little bit. So before, they said that any camper outside of New England needed to have to attest to a home quarantine for 10 days before camp. New Hampshire has just eliminated that guideline. And so now all campers who come from the United States will not need to home quarantine before coming to camp. However, any of our campers who come from other countries do need to attest to that home quarantine for 10 days before camp. We're also going to require pre-arrival self-screenings of all of our campers and staff before arriving at camp. And those self-screenings will be looking at symptoms and risk factors for COVID. In addition, we're going to require proof of a pre-camp PCR screening test for all campers with a negative result 7 days before arrival at camp. And so that applies to everyone. All of those things, the attesting to a home quarantine, the screening questionnaires, and submitting proof of a negative COVID result will happen via Camp Doc. And if you're new to Takodah this year, Camp Doc is our electronic health record system that will deploy sometime in mid-April. You'll use it to submit your physical exam, include information about your camper, everything from, your bedtime routine to, if they have special food preferences and things like that. You're going to fill out all of that information, and all of that helps us to create a really positive experience for your camper. And in addition, this year, it will have a special COVID section where you'll attest to that home quarantine if you're an international camper. And for all of our campers, it will attest to the home screening questions and to the negative PCR test prior to camp. And again, I just want to really emphasize, and we're doing this with our campers, our staff, and our professional team as well, everybody who's going to be at camp, that all of our personal decisions have much greater consequences this year. And so in that time before camp, especially those 10 days before camp, we're really relying on everyone to make the safest and healthiest decision possible so that when they migrate into our camp bubble, we can keep that bubble as safe and healthy as possible. Shifting our attention to arrival and departure. So when you arrive at camp, we'll require screening questions and temperature checks for everybody upon arrival. And of course, we'll need to refuse admittance to anyone who is symptomatic or exposed to COVID. On that first day, we'll require face masking and social distancing for everyone at camp. In addition, we're going to do staggered arrivals to minimize the number of people in camp at one time. So typically on an opening day, we'll have about anywhere between 500 and 1,000 people arrive at camp at the same time. And obviously that's a challenge this year in light of COVID. So we're going to stagger those arrivals. We're not entirely sure how we'll do that right now, but it may look like 3 campers from your cabin arriving in a 30-minute time block. So maybe you'll be scheduled with 2 other campers in your cabin to arrive between 2 and 2:30. You'll need to depart before 2:30, and then at 2:30, 3 more campers from your cabin will arrive. Again, we'll provide more information about that prior to camp. We are going to continue airport runs to and from Boston Logan Airport. And all the same pre-arrival guidelines apply to campers who are arriving by air travel as they do who are being dropped off at camp. One thing that we need to do this year that I know might be a little hard is that we're going to limit drop-off to 1 parent or guardian per camper. And again, that serves to minimize the number of people in camp, which will minimize the risk of a COVID transmission in camp. So if you're dropping off 1 camper, that means only 1 parent or guardian will be able to enter camp with that camper. If you're dropping off 2 campers, then you could bring 2 parents as long as 1 parent sticks with each camper during the duration of your time at camp. In addition, when you drop off your camper, you will be parking and walking with them and their luggage to their cabin. And you're essentially going to drop them off at the front porch. And again, I know this is going to be a little hard for families. Some families are used to going into the cabin, helping to make the bed, get the gear organized. But again, this year in light of COVID, we'll need to restrict the number of people in cabins. So you'll drop them off at the cabins, and your cabin leaders will be happy to help your campers get settled, make their beds, and feel comfortable at camp. So when you drop them off at camp, you will not be able to wander around camp this year, and you'll need to depart right away. It's a little thing that we can do to keep camp a little bit safer. So now shifting our attention to ongoing screening and diagnostic testing. So again, we're going to conduct screening questions and temperature checks for everyone at camp every day. That will help us quickly identify anybody who might be starting to show symptoms of COVID so that we can respond with our quarantine and isolation procedures right away. And that will help us minimize the possibility of an outbreak at camp. We're going to require a PCR screening test on day 1 for everyone. The good news is that those PCR screening tests at this point, we anticipate being saliva-based tests. I know that will be so much easier for our campers who maybe have never had a COVID test and might feel really uncomfortable with the nasal swabs. So we have established testing partnerships with Haywood Hospital and also Cheshire Medical Center. Both of those hospitals right now are doing trials of the saliva-based PCR test. We have every indication to believe that those will be approved. And if so, those are the tests that we will be using this summer. So again, we're going to have a PCR test on day 1, which is drop-off day, that first Sunday. And then we'll do an additional PCR screening test for everybody on day 5 of camp. That will help us quickly identify anybody who might be infected or exposed, and again, respond with those quarantine and isolation procedures right away. Our testing partners are absolutely wonderful this year, and they have said that we can expect those test results within 24 hours or less of when we submit them. So for example, on opening day, we intend to submit those tests in the afternoon, probably 4 o'clock or 5 o'clock in the afternoon after we PCR tested everyone. And we can expect to have the results by 7 a.m. the next day. So it's a very quick turnaround, and we're absolutely grateful for that and the ability to be able to respond right away. In addition to the scheduled PCR tests, we'll have the ability to do rapid antigen testing and PCR testing as needed for campers who present with symptoms. So shifting to our isolation and quarantine procedures. As I've said before, last year when camp ran within, well, when Takodah ran, but when other summer camps ran, served about 90,000 campers and only 102 were infected. And that happened during sort of the worst of times when we knew a lot less about COVID. We know that it is unlikely that we'll have infections at camp. And at the same time, since we can't eliminate all possibilities of an infection, we do have standardized isolation and quarantine procedures in case it happens. So with these, we are going to follow standard healthcare procedures that are prescribed by Cheshire Medical Center. For reference, Cheshire Medical Center provides all of our standing orders, and all of our health center staff operate under those standards all summer long. We're still waiting on those standards for this year because they're integrating COVID information and guidelines into those standing orders. So for example, we know that every day at camp, about 50 campers and staff present with symptoms that could look like COVID. A lot of those are allergies or a sinus infection or swimmer's ear. They're very minor things, but the symptoms do look very similar to COVID. So what we're looking for with Cheshire Medical Center is to help us identify what triggers cause for alarm with COVID versus a camper who just presents with allergy symptoms. So again, that's something that we're still waiting on. And as soon as we have that information, we'll present that to you. But when somebody does present with symptoms and our standing orders identify that those would be cause for concern with COVID, we're going to test and isolate that person immediately until the test results are available. So that person will have their own private room and bathroom. Those results will be returned to us in less than 24 hours. And then anybody with close contact to them, so that would be anybody in their cabin, and close contact is defined as somebody who is with them for 10 minutes within 6 feet of them. All of those people with close contact, their cabin mates, will be quarantined until those test results become available. Now, I know quarantine sounds pretty awful, but it's actually a lot better than it sounds, because quarantine doesn't mean that you're stuck in your cabin. It just means that that cabin must stay separate from everyone else in camp. So a quarantine cabin could still go to the waterfront and go swimming as long as nobody else is there, or they could go to the archery range and shoot archery as long as nobody else is there. So we will not be sticking campers in a cabin where they can't go anywhere else. It'll just be enhanced precautions, and quarantine will provide a very minor disruption to their camp experience. Of course, if we suspect COVID, we're going to absolutely clean and sanitize all exposed areas and equipment immediately. And then we're going to wait for those PCR tests to come back. We assume that in most cases, the PCR test results will be negative for COVID, and at that time, everybody in the cabin will shift back into our normal programming. However, if a test does come back positive, then the person with the positive COVID test will need to be dismissed from camp immediately via private transportation. As a public health standard, we are not allowed to drop that person off at an airport or put them on a bus or in a taxi. They will need to leave camp by private transportation. And so it's really important that all of our camp families have backup plans in place so that they can provide that transportation within a couple of hours for an infected camper away from camp. So especially for our campers with families who live out of state or internationally, it'll be really critical that you have somebody in the area identified who can pick up your camper immediately if there is a positive PCR test for COVID. In addition, we'll also need to dismiss anybody who had close contact to them. And so if a camper is dismissed from a cabin due to a positive PCR test, all of the other campers and staff in that cabin will also need to be dismissed from camp immediately. Of course, we're going to deep clean all exposed areas and equipment immediately. So again, please make sure that you have a backup plan for immediate pickup in case of infection. And of course, this year, anybody dismissed from camp because of a COVID infection or exposure will receive a prorated refund. So if your camper is dismissed from camp, we'll look at the portion of their fees that weren't spent based on the number of days that they were at camp, and we'll refund all of the rest of that to you. One of the most important things that we can do to prevent any spread of COVID at camp is to practice good personal hygiene. As I said before, we've hired a COVID safety officer this year, and her whole job is to be present around camp and make sure that everybody is following all of our COVID guidelines and personal hygiene standards. But it can't all fall on her. Of course, our entire leadership team will be very present around camp and reinforcing our COVID standards and personal hygiene standards. And we're going to train all of our cabin leaders on these standards, and we'll be holding them accountable to them all summer. During the first day of camp, during that drop-off day, all campers will go through a COVID safety orientation with our COVID safety officer. If you've been to Takodah before, you know that all campers go to a waterfront orientation on the first day of camp, and that helps them understand all of the special safety concerns of swimming at our waterfront. Well, similarly, we're going to have a COVID orientation, and we'll go over all the standards with our campers then. Those standards require regular hand washing and sanitizing. We use a 70% alcohol solution. We use Purell, and that will be all around camp. We're going to require reusable, washable cloth face masks. We're discouraging disposable masks. We really want to see reusable, washable cloth face masks. And we're going to ask you to bring the same face masks that are required for school. So in other words, at schools, you're not allowed to use bandanas or gaiters. You're also not allowed to use masks with vents. And so we're relying on everybody to use old-fashioned cloth washable face masks. So same as the school requirements. We're going to ask you to bring several of those masks to camp so that you can circulate them and always have a clean one to wear. We'll also sell face masks in our camp store at our own cost. So we know if a camper forgets masks or doesn't have enough, they'll be able to buy additional face masks at our camp store. And we know that those will be under $3 at the very most. And of course, we're going to provide laundry service to all of our campers and staff this year so that they always have fresh face masks. So we'll identify a certain number of those masks for you to bring. And then every few days at camp, campers will have a chance to put all of their dirty face masks into a bag. Of course, it'll be important that you label all those masks with their first and last name. We'll wash and dry all of those masks by cabin and then return all of those face masks so that everybody has fresh face masks to wear. This year, we're also going to require reusable, washable water bottles for all campers and staff. All of our water fountains at camp will be converted into spigots. So this year, it's not safe for campers to drink directly from water fountains. Those will be converted into spigots, so campers will be able to fill their water bottles that way. And we'll have surface sanitizer at all of those stations so that campers can sanitize the spigot before and after filling their water bottles. Around camp, we'll also require social distancing of 6 feet. We'll teach and require everyone to cover coughs and sneezes. We'll teach and require everyone to avoid touching their eyes, nose, mouth, and face. And of course, we're going to prohibit everybody from sharing personal items. And within the cabins, all of those personal items will need to be kept separate at all times. Now, shifting our attention to cabin cohorts. So all of our cabins accommodate 2 cabin leaders, 10 campers, and some cabins will also have a leader in training. If you're new to Takodah, a leader in training is a high school senior who is learning to be a camp counselor at Takodah. And so they have apprenticeships in the cabin where they function as assistant counselors. So it's possible that your cabin will have between 12 and 13 people in it. Right now, we do not plan to change any of our cabin capacities. Within the cabin, face masking and social distancing is not required. So think of your cabin as your family cohort. When you're with your cabin, whether you're inside your cabin or outside of your cabin and away from other cabins, You will not need to wear face masks or engage in social distancing. Again, we'll have the same capacities in cabins. We'll be spacing bunks as much as possible, and we'll mandate that all of our campers and staff sleep head to foot. So there will be at least 6-foot distance between heads. Again, there will be no sharing of personal items, and they will need to be separated at all times. Also this year, we're going to need to keep windows open at all times in the cabins. So our South Camp cabins are already configured with windows and doors that make airflow very easy throughout. In our newest North Camp cabins, we have fewer windows. So this spring, we're installing additional windows in those newest North Camp cabins to encourage better airflow. Also at South Camp, in the past, you've probably seen that our cabin leaders often prop the windows open with precariously placed twigs and things like that. Whereas in North Camp, we have nice chains on all the windows that hold them open. So we'll be installing those chains in South Camp as well to ensure that those windows stay open at all times. That will, of course, create a lot better airflow and make those cabins a lot safer. What it also means is that we're going to encourage all of our campers and staff to bring a little bit warmer bedding and clothing for those cool nights at camp. So again, your cabin cohort is your family group, and when you are with your family, face masking and social distancing is not required. So now shifting our attention to our bathrooms, which we call the twins. So shower time and time spent brushing teeth are the times that require the longest in those bathhouses. So we're going to schedule times for cabins to come to the bathhouse together to brush their teeth and take showers all together. So again, one cabin per bathhouse at a time. The cabins will have 15-20 minutes to go in. Again, because they're already a family cohort, they will not need to face mask or socially distance. They'll be able to take showers, use the toilets, brush their teeth, and then they'll exit. Everything will be sanitized and the next cabin will come in. And that's how we'll keep those times safe. And that usually happens morning and bedtimes. Of course, you can't always schedule your bathroom times during the day. So daytime usage will be in those bathhouses, and everybody during those times will need to use proper face masking and social distancing. All of our toilets have nice wooden partitions, so those are safe areas to use. Our sinks are trough style, and so they don't lend themselves to being able to install partitions on them. And again, that's why it's going to be especially important that campers wear face masks and practice social distancing in the bathrooms, and we'll have bathroom monitors to make sure that happens. Now shifting our attention to dining. In the past, we've had everybody eat in the dining hall at one time. And so sometimes that's over 350 people in the dining hall at one time. And during normal times, that's a very fun and energetic time. But this year, it's not safe in light of COVID. So we've created 3 different dining locations. One of those dining locations will be in the dining hall as normal. One will be on the dining hall terrace, which is directly adjacent to the dining hall and outside. And on the terrace this year, we've installed shades to protect campers from sun and rain. So that'll be a really nice place to eat. And then we're also going to be installing a large wedding style tent at camp as our 3rd location. And that means because we have 3 locations and 3 divisions, that each division will have a dining area. If you're new to Takodah, a division is made up of 7 cabins. So campers are divided into cabins based on age and gender. And then 7 cabins are grouped together in a division, and those are based on a slightly larger age range and the same gender. So I might be in cabin 21, and that means that I'm a 7-year-old camper and I'm a boy. So I'll be in cabin 21. That's my cabin. I'll be in there with other boys who are also 7 years old. But we're going to be in a division with all of the buffaloes, and that will be 7 cabins. And that means our division will probably be other boys ages 7 to 10 years old. So our division will be assigned to one of those dining locations to eat. Those dining locations are large, and so tables will be able to be very spread apart. The guidelines prescribe that tables need to be at least 6 feet apart, but our tables are going to be much farther apart than that. Of course, hand washing and sanitizing will be required before and after eating, and we've installed a bunch of extra hand washing stations to make sure it's easy and efficient for all of our campers to wash their hands before and after meals. For breakfast and dinners, we're going to do family style dining. And what that means is that the cabin will come together and sit around a table together. The cabin leaders will go to the kitchen and retrieve large bowls of food. They'll bring them back to the table. So one of those bowls of food might be lasagna. Another bowl might be green beans. Another bowl might be garlic bread. They'll bring them back to the table and they'll serve all of the campers from those bowls. So in the past, we've had campers pass around the bowls and serve themselves using those utensils. This year, as an extra safety precaution, cabin leaders will be serving campers directly so that there are no shared bowls or utensils. Unfortunately, within this system, it means that we're not able to do any breakfast bars, salad bars, soup bars, or sandwich bars. And we know that our campers have come to love all of those things. And so we've worked hard to provide good alternative options for them. So for all lunches and dinners, we'll have prepared salads on every table, again, that campers can enjoy. We'll have sun butter and jelly kits available. We also might have deli meat sandwich kits available. Our food service company is currently investigating those. So campers will be able to take a kit and make their own peanut butter and jelly sandwich from those. We'll have soups available. And again, cabin leaders will serve soups to campers who are interested in those. And in addition, new for this year, we'll have individual boxes of cereal and individual milks available on every table so that our campers, if they're not excited about the main course that's being served and they don't want a sandwich or a salad, they can always eat cereal. In addition, I just talked to our food service company, and they know how much our campers love our soup, salad, sandwich bars. And so they're looking into other options that we can provide single-use, single individually wrapped items that campers can use to supplement our regular menu. Right now, our food service company is reviewing our menu to make sure that everything still looks good within this new system, but we anticipate that our menu will stay largely the same. At the end of every meal, traditionally, all of our campers get up and there's like a giant parade around the dining hall where campers are taking dirty dishes into our kitchen to be washed. Obviously, that's not going to work this year in light of COVID. So every table will receive a bus tub. The leaders will help the campers put all of their dirty dishes into those bus tubs. And then after all campers have left, our kitchen staff will come out, collect all the bus tubs, wash and sanitize all of those, and also wash and sanitize all surfaces in the dining hall before the next meal service comes in. So everything I just talked about was for breakfasts and dinners. And the reason we're doing those family style is because mealtime at camp is a lot of fun, and campers love the singing and the music and the dancing and everything that goes along with meal times. So it's important that we're still able to maintain those traditions through family style dining for breakfast and for dinners. For lunches, we're going to do pre-prepared boxed lunches. And our goal is that cabin leaders can come and they can pick up all of the meals for their cabin. And then if it's a beautiful day, the cabin can go wherever they like in camp and enjoy a really nice picnic lunch together. On those bad weather days, cabins will still be able to go to their assigned dining locations, whether it's the dining hall, the terrace, or the wedding tent, and enjoy their meal there under cover. Also, to make things a little bit more fun, we're going to rotate assigned dining locations. So maybe I'll have breakfast in the dining hall, I'll have a picnic lunch, and then for dinner, I'll be at the terrace. And the next morning, I'll be in the wedding tent, I'll have a really nice picnic lunch, and then I'll be back in the dining hall. So campers will get to experience different areas of camp for that. And again, our food service company is working really hard with us to make sure that we're providing campers with options to be completely happy and satisfied with every meal. Now shifting our attention to camp programming. Camp programming is going to be a little bit different this year, but we're actually doing some things that we think a lot of campers might like even better, and some things that we anticipate taking into the future, even once we return back to normal. Our programming is going to look a little bit different between week 1 and week 2. And the reason for that is once week 2 rolls around, it means that all of our campers will have had 3 negative PCR screening tests and nobody has been symptomatic. At that point, our medical advisory team tells us that we can be reasonably confident that camp is a safe place. So week 2, we're going to be able to open up our programming a little bit more, but as an extra precaution during week 1, we're still going to limit things a little bit more just to keep all of our campers and staff safe. So what does that look like? Well, during week 1, all of our classes will be done by divisions. And again, a division is made up of 7 cabins and about 70 campers. We're going to have classes available and campers will get to choose which classes they want to take. For each class period time, there are going to be between 7 and 8 class options available. And that's fewer options than campers have had in the past. And we know that that's the case. We're going to offer our most popular classes during that time to make sure that campers always have something that they're really excited about. During that time, evening programs and special events like candlelight ceremonies, chapels, evening programs, those kinds of things are going to be done in divisions. So again, during those class times that you're doing with divisions and during those special events that you're doing with divisions, campers will need to be face masked and socially distant, but they will get to mingle with campers outside of their cohorts, staff outside of their cohorts, and they'll still get to choose their own classes and choose the options that are exciting to them. The big difference this year is recreational swimming, because that's the one time when it's really hard. We're not able to face mask during swimming, and social distancing is challenging too. So all recreational swimming will be done by cabin. Now, division will be at the waterfront at one time. So maybe my division, the Buffaloes, will be at the waterfront. That means 7 cabins will be down there at the same time. All of those cabins will be assigned a specific area of the waterfront distant from all of the other cabin cohorts. So then week 2 programming is a little bit different. As I said, at this point, assuming that we've had negative PCR tests all the way through for all of our campers and staff, and we've had 3 verified negative tests, 2 of which have happened at camp, we can be reasonably confident that camp is a safe place. That doesn't mean that all of the guidelines disappear, but it does mean that we are going to open up classes and do classes as we always have, and we'll do them camp-wide. So this time, if you're in South Camp, you'll be taking classes. There are about 210 campers who will be involved in those. We typically offer between 20 and 25 classes, and campers will get to choose from the full array of classes that we have to offer at Camp Takodah. Again, we're going to offer all of our most popular classes, but we'll have even more options than the first week. Evening programs and special events will still be done by division. And I think that actually, as we've been talking to parents and campers about this, a lot of folks are really excited about it, because it means that evening programs will be with 70 people instead of about 250. And that means that those experiences can be a little bit more immersive and engaging. And especially for our campers who might be a little bit more shy or introverted, we anticipate that they're going to feel a lot more comfortable in this smaller programming. We also think that when we do programming on a little bit smaller level, say 70 instead of 300, we can do a little bit more cool stuff. And so we're excited to try this out this year. And assuming that it goes really well, next year we might incorporate a little bit more division programming into camp. Recreational swimming will remain the same as the first week. Campers will be swimming by cabin, grouped into divisions, and all cabins will be assigned certain areas of the swimming part. So maybe during the first part, we'll be assigned to the shallow end where we can play games and things like that. The next day we'll be assigned to the water trampoline where we can enjoy that. The next day we'll be assigned to the area with the waterfront tower and the water slide and the diving board. So again, campers will get to experience all those things. We'll just need to do it a little bit differently to keep everyone safe. So during all of our programming, again, because campers are going to be mingling with folks outside of their cabin, we're going to require proper social distancing, face masking, and personal hygiene. All of our programming this year will be conducted outside. And in fact, in years past, most of our programming has been conducted outside, although some of our performing arts classes and our arts and crafts classes have happened inside. Now all of those are shifting outside. Of course, we'll sanitize all program areas and equipment in between uses. One thing that many of our campers and families are excited about this year is that we're eliminating mandatory swim lessons. We wholeheartedly believe in the value of swim lessons as being something that could potentially save your life or someone else's life in the future. And at the same time, we know that there's just no way for us to do that in a safe and healthy way this summer. And then next summer, we'll have to decide whether mandatory swim lessons will be back or whether we'll continue this way. The other thing that we often do at camp is take campers on field trips. And those field trips often happen with campers who are a little bit older. They tend to go places like Mount Monadnock to hike up the mountain, or they'll go to Rose Ledges to do rock climbing in the outdoors, or maybe they go on a special mountain biking trip. This year, we're going to really need to limit those field trips. And it's possible that we won't do field trips at all. We're still working through those details with our medical advisory team. But if we do field trips, campers will need to be face masked and socially distant during those times. Of course, we'll need to disinfect and sanitize our vans between use. If we do take trips, we'll be going to non-populous places where campers would have no interactions with the public. And again, we would follow all the same guidelines that we typically follow at camp. Now shifting to education and communication, which I think is going to be really important this year. As I said, we're going to provide educational materials to you before camp on face masking, social distancing, and personal hygiene that we're going to ask you to share with your campers and reinforce with them. We'll also post signs around camp on personal hygiene and everyday preventative measures. We're going to train all of our staff on our COVID communicable disease guidelines, personal hygiene, and time off expectations. And all of our staff at camp will be responsible for adhering to these guidelines and reinforcing these guidelines with their campers all summer. As I said, we're going to provide a COVID orientation to all campers and staff on the first day of camp. And with all of our PCR testing and any antigen testing that we do, we're going to report all of those testing statistics to public health officials and to all of you. So as soon as we get those results, we'll share them immediately with you. We'll also report any symptoms or exposure and also any isolation and quarantine to our families as well. And in addition to that, we're going to ask all of you to share any symptoms or possible exposures with us. So maybe you drop your camper off at camp. A few days later, you start experiencing symptoms of COVID. It's possible that you might have COVID. It's possible that if you have COVID, your camper might also have COVID. If that's the case, we're going to ask you to contact us immediately so that we can run a PCR test on your camper right away to determine if they are exposed to COVID. And if they are, we'll launch into our quarantine and isolation procedures. And if their test comes back negative, you can rest assured that they're all set. Just a few more considerations. This year, we will not be able to allow any non-essential visitors at camp. So unfortunately, that means that no parents or family members will be able to visit their campers at camp. And we know that's hard. And again, it's just a really important way that we can keep camp safe this year. You'll see many additional maintenance and housekeeping staff around camp so that we can provide even more routine, frequent, and enhanced cleaning at camp. As I said before, there will be many additional hand washing stations around camp. If you've ever seen our health center, it's fairly small. And so instead of having potentially symptomatic or infected campers coming in and out of a small building, we're going to be setting up a large tent outside of our health center. And that's where all health complaints, triage, and medication distribution will occur. And that's going to help keep our healthcare team safe and also all of our campers who need to visit our healthcare team safe. Our healthcare team will be wearing personal protective equipment anytime they're seeing or treating anyone at camp. Also, in an attempt to minimize the number of people coming and going from camp, We'd like you to consider mail and packages. Campers absolutely love receiving mail and packages at camp, and we're hoping that you can do it a little bit differently this year. So we're really going to encourage everybody to use our camp email system. If you're new to Takodah, we have an email address where you can send a one-way email to your camper. We print those emails off once a day and deliver them to all of the campers. Campers aren't able to respond to that, but it's a quick way for you to write them a nice, encouraging note while they're at camp. So we're going to encourage you to use that. We're also really going to encourage you that if you want to deliver handwritten cards or letters or packages, that you bring all of those with you on the first day of camp and drop them off at camp. That's something we've always really encouraged of parents. And I think the main reason is because we live in a rural setting and often mail takes a long time to arrive at camp. So every session, after the session, we get a ton of mail for campers, and it just came too late to be delivered to campers during that session. The best way you can avoid that, and this year a way that you can avoid all of those delivery drivers constantly coming and going from camp, is by bringing those packages and the mail when you arrive at camp. It's super easy. There will be a designated area where you can drop off all of your mail and packages. On the mail and packages, you simply write your camper's name, their cabin number, which you'll get when you arrive at camp, and then also the day you want that package or letter delivered to them. And then our office staff will make sure that that happens. So that's the best way that you can make sure your camper gets exactly what you want when you want them to get it. And it also minimizes delivery drivers coming into camp, which helps keep us all a little bit more safe. With open house, we're doing a couple of things. We know open house can be particularly important to first-time campers and families. It just helps them feel a lot more comfortable with camp. So this year, in light of COVID, our camp directors will be recording a virtual tour all around camp. We'll cover all the same locations and topics and most frequently asked questions that parents and campers ask. We'll video that, and we'll send those videos out to you probably around the end of April. And we would encourage you to watch those videos with your camper. And our hope is that after watching that video and after seeing some of the other videos on the Takodah website, that you're going to feel comfortable with camp, and that it won't be necessary for you to attend an in-person open house. However, we know for some families, they're really going to need that in-person open house to feel comfortable with camp. And so that in-person open house will be on May 8th. In the past, we've just had everybody arrive at the same time. We give everybody tours, and it's not uncommon for us to have 200 people at camp at the same time for open house. Obviously, that could be a public health concern this year, so it'll be a little bit differently. If you register for open house this year, you'll be registering for a specific time. So maybe you'll register to attend open house on May 8th from 2 to 3 p.m. That will be your time slot. We'll have a limited number of people during your time slot so that we can accomplish face masking, social distancing, and keep everybody safe during that time. Again, though, we're going to ask campers and families who feel comfortable with camp to avoid that open house and to really give campers and families who really need that opportunity the chance to see camp on that day. One of the other things that we're still sort of working through is our camp store. So one of the funniest things that happens every day at camp, right after siesta, which is our rest hour right after lunch, there's a bell that rings, and instantly you'll see 100 campers burst out of their cabins and run right to the camp store because they want to go shopping and they want to buy ice cream. And there's always huge crowds right there. And this year, that's obviously a public health concern. So we need to change the way we do the camp store. So there are a few things that we're working on right now. We're working on camp store pre-orders. What we'll have is a Shopify account, and you'll be able to go on Shopify, pick the clothing that you want and the sizes that you want, order those, and instead of shipping it to your house, you can select pick up at camp. And so when you and your camper arrives at camp, there will be a bag with their name on it in their cabin waiting for them with all of the merchandise that you ordered. One of the extra benefits to this, well, I guess I should say, we've been thinking about doing this for a couple of years, because sometimes if you come during session 4, we're a little bit more limited on options and sizes. By doing the pre-orders this year, we can absolutely guarantee that you'll get exactly the clothing and merchandise you want in the sizes you want. So this is a huge benefit, not only in managing COVID, but in also making sure that your camper has exactly what they want. Um, However, we'll also have opportunities for campers to buy merchandise at camp. So we'll do a couple of things. We'll set up all of the clothing in the foyer of the dining hall. So everybody will see all of the merchandise that's available. And campers can use order forms to order the merchandise that they want. Our office staff will process that with their Camp Store account. And again, we'll deliver a bag directly to their cabin with your camper's name on it that has exactly what they ordered. So maybe they forgot their favorite stuffed animal at home. They want to buy a stuffed animal from the Camp Store. They'll put in that order, and that same day, that stuffed animal will magically appear in their cabin for them. We also anticipate scheduling some shopping time for campers at the Camp Store. And if we do that, we'll do it by cabin. So maybe I'm in cabin 21, and Tuesday at 4 o'clock, cabin 21 has the Camp Store all to ourselves. We'll get to go there. We'll get to shop. Again, because we're with our cabin cohort, we won't have to worry about face masking or social distancing. We'll be able to buy whatever we want. And then the last thing that I know will absolutely delight campers is ice cream. So we've always served ice cream from our Camp Store. Campers absolutely love it. We're going to do the same this year. But this year, what we anticipate doing is having ice cream wagons or ice cream carts that will circulate to each cabin during that siesta or rest time. Campers can place their orders. We'll give them the ice cream right then and there. So they'll still be able to enjoy ice cream, but in a safe and socially distant way. The last thing I want to talk about is something that doesn't apply to everybody. It only applies to our changeover campers. So if you're new to Takodah, if you attend 2 subsequent consecutive sessions, that weekend in between is called changeover weekend. And so let's say you register your camper for session 1 and session 2. That weekend in between, your camper has the option to stay at camp for free and enjoy a little bit more low-key programming. This year, all campers who are attending consecutive sessions must remain at camp during that changeover weekend. So this year, you will not have the option of picking them up. And I know that's a bummer, but it's really, really important to maintaining a safe camp bubble for us. In addition, parents and guardians, friends and family will not be able to visit their campers during that changeover weekend. The only exception is if your camper is fully vaccinated, then you could pick them up from that changeover weekend. But if you did that, you would need to pick them up and take them away. You would not be able to stay and wander around camp. And that's an important way that we can keep the rest of our campers safe while they're at camp. We know that it's going to be hard not to see your campers for a month at a time or 6 weeks at a time, or maybe even 8 weeks at a time. So during those changeover weekends, we'll be happy to schedule phone calls, Zooms, Skypes, or FaceTimes so that you can have a little virtual time with your campers, check in on them, make sure they're having a great experience. They can say hi to you, tell you a little bit about their camp experience so far, and then they can continue with the changeover weekend. So since you're not able to pick them up during that time, all campers who are here for changeover weekend will make use of our laundry service, which is something we've always provided. We use an outside company to do camper laundry. So they do the laundry, they fold it and return it. Campers bring laundry bags with them, cloth or mesh. They put their dirty laundry in there. We take it to this laundromat. They do the laundry, they fold it, they put it back in the bag, and then we return it to the camper. And we charge you exactly what they charge us. For most campers, that's right around $12 per session. So if you're a changeover camper, you want to make sure that you put that extra $12 in your Camp Store account so that come laundry service time, we'll do the laundry for them. We'll figure out how much their bag is. Maybe it's $8, maybe it's $14, whatever it is, and we'll deduct that from your Camp Store account. The last thing is the programming during changeover weekend will be pretty much the same as it's always been. And changeover weekend is awesome because it's a smaller group of campers, say 30 campers, smaller group of staff, and those campers essentially get to take over camp. And so during the morning of changeover weekend, the leaders will say, hey, what do you all want to do today? And they'll say, oh, we want to do the water trampoline, and we want to do archery, and we want to do rock climbing, and we want to watch a movie, and we want to do this, and we want to do that. And the leaders say, Cool, let's do it. And so they do all those things throughout the day. At this point, again, campers have gone through an entire session and 3 negative PCR tests. So at this point, we're very confident that they're safe. At the same time, we're going to use reasonable precautions in terms of face masking and social distancing, but the programming will still be as good as it's ever been. The only difference is sometimes during changeover weekends in the past, we've taken campers on field trips to get ice cream at Kimball's Farm or to go do mini golf or something like that. This year during changeover weekend, we're going to prohibit those field trips. But again, changeover campers are going to have an amazing time and really enjoy their experience. And if you would like to set up, a video call or a call with them, we're going to be happy to do that for you. Okay, so we've gotten to the end of the information. I just want to go over a few quick things in terms of next steps. First of all, at this point, if your camper has any health conditions that put them into a vulnerable or high risk category, then at this point, we really need you to reach out to your primary care physician to consult them on whether summer camp is a reasonable option for that camper and for your family this year. We're not restricting anybody from coming to camp. And at the same time, we really care about the health and safety of all of our campers, and we want to make sure that you are informed of all the risks. And if your camper is especially vulnerable or high risk, we want to make sure that you're managing those things with their primary care physician. If you still have questions about summer camp, so if there's something we missed, or if you have a question that's really specific to your camper, then please email us. We will love to tell you everything you need to know and help you in every way we can to help you make the best decision about this summer for your camper. You can simply go to our website, which is camptakodah.org, and there you can find all of our contact information. So feel free to reach out to any of us, and we'll be happy to help you in any way we can. Lastly, please remember that our cancellation deadline is April 15th. So we're so glad that we can provide this information to you on March 30th and give you a little over 2 weeks to make a decision about whether summer camp is right for you. If you cancel on or before April 15th, you'll receive a full refund of all your fees, including your $125 deposit. We'll give you a few options. We'll either refund that directly to you. If you prefer to transfer that as a credit for next summer, we're happy to do that. And of course, if we're still these are trying times for us financially. And so if you do have the ability to donate some or all of your tuition to help our campership fund or a COVID emergency fund, we would appreciate that as well. But there's absolutely no obligation. So just remember, if you do want to cancel, make sure you do that on or before April 15th, and that gives you the option of a full refund if you want that. And we certainly understand anybody needing to make that decision this year. If you do need to cancel this year because summer camp doesn't feel safe enough to you yet, we certainly hope to see you back at Takodah next summer. So in wrapping up, thank you so much for joining the webinar, and thank you for your continued support of Camp Takodah. We know that kids and families need summer camp more than ever this year. I think for all of us as professional staff and all of our camp staff, we couldn't be more excited about being back at Takodah and bringing all of our campers back together for an amazing summer camp experience. We know this year will be a little different, but we think it will be just as good as ever. And we actually think that there might be a few things we're doing this year, whether it's camp store pre-orders or programming on a slightly smaller scale, that might really resonate with a lot of campers and staff. And it might be something that's maybe even more memorable than ever. So we wish you all the health and happiness over the spring months and finishing out this school year. Again, we're here to help you with anything you need, and we can't wait to see you back at Takodah this summer. Thanks so much, everyone, and we'll talk to you soon. Bye.